So there are two slides. Once you've done reading this one, please tell us. I'll move to the second one.
Okay.
All right, moving to the second.
Okay.
Right. So if you've read and understood, considering it critical care scenario, please tell me, how would you manage this patient now?
I would uh, I would start like with the patient. So I would enter the station. I would wash my hands.
Yes.
Then I would ask the patient confirm the identity of the patient.
You've done that. Yes. Just tell me the management according to the which
Okay, ma'am. So
protocol?
in this patient, I would after examining the tummy, then I would switch on as the patient would be in severe pain. I would switch on to care of critically ill surgical patients. Then I would start assessing from airway, breathing, and circulation. I would
Yes.
talk to the patient. So if the patient is able to reply me his name, that means airway is clear.
Yes.
Then I would go on to the breathing. So in the breathing, I would look at the patient's neck to see for deviation of trachea. I would assess the trachea to be the midline, and then I would see the patient's chest for breathing, like if it's equally moving on either side. Then I would inform the staff nurse to, as the patient is in distress, I would ask the staff nurse to connect put the patient on oxygen, nasal oxygen at 15 liters O2. And then I would ask the staff to count the respiratory rate for me. And then I would check the patient's chest, whether it's moving equally on either side. And then I would do a percussion on either side, just to do percussion on the front of the chest. And then I would tell the patient that I'm going to place my steth and hear the sounds on either side. So I would check the chest either side to check for any creps or crepitations is there. I would ask the patient to show the tongue for signs to see signs of dehydration or any cyanosis if it's there.
Okay. Can you please tell me, after you've read the scenario, what is the provisional diagnosis that you'll consider?
First, I would for this patient, I would consider acute pancreatitis.
Okay. What other differential diagnosis would you keep in your mind while managing the patient?
It can be acute duodenal or gastric ulcer perforation.
Okay.
Then acute cholecystitis.
And quickly.
Ascending cholangitis.
Okay.
Can be pseudocyst
rupture.
Right.
Okay. Can you tell me what is the pathogenesis behind acute pancreatitis?
It can be due to ductal obstruction leading to retrograde flow, or direct acinar injury by toxins or any other.
Yes. Quickly. 3 more.
It can
protease release, and then
hello.
Yes. Continue, please.
Oh yeah, protease release and elastase release, or it can be amylase release, or lipase leading to the destruction of
fat necrosis.
lipase leading to fat necrosis.
Please tell me how many criteria you are aware of which can assist you in diagnosing or confirming your provisional diagnosis as acute pancreatitis.
Ransom scoring or Glasgow scoring.
Yes, and
the Balthazar scoring.
Yes, very good. Please tell me about the Glasgow criteria.
The WBC count more than 15,000, and then glucose more than 10 millimoles per liter. Then PaO2 less than 60 millimeters of mercury, and then age more than 55,
Yes.
and
All right. Good.
LDH.
Thank you. Please tell me, why do you think this patient is tachypneic?
There is a possibility of ARDS, acute respiratory distress syndrome, or it can be because of the pain.
Please explain the mechanism, how it's causing tachypnea.
It can be due to acute respiratory distress syndrome, secondary to inflammation of the secondary to sepsis or toxins affecting the lungs, or it can be due to pain.
All right. Okay. Please tell me two situations in which, in acute pancreatitis, serum amylase levels would come out to be normal.
Um, I'm not sure.
All right. Please tell me what might be the cause of hyperglycemia in case of acute pancreatitis.
So it can be due to destruction of the pancreatic islets of Langerhans, or
Yes.
it can be due to stress.
A stress hormone release like glycogenolysis and
Yes.
glucogenesis. All right. Please tell me, which enzyme would you test if you suspect acute pancreatitis?
I would check for amylase, serum amylase, serum lipase, and lactate dehydrogenase.
Yes. Do you think serum amylase is important in when it comes to scoring system for the diagnosis?
No.
Okay, please tell me what radiological investigations you will carry out.
I would like to get a chest X-ray to rule out any ARDS. I would like to do a contrast enhanced CT of abdomen to check for the presence of pseudocyst or any other pancreatic changes, whether there is any fat stranding or inflammation.
Okay. All right. If you don't get to manage your patient on time, and what complications should you watch out for?
Local and systemic complications. So local
Yes.
complications, there can be bleeding, it can be hemorrhage, or it can be pressure causing rupture into the cyst rupture into the bowel or into the stomach, or
Yes.
systemic complications like ARDS, acute renal failure, paralytic ileus, or hypoglycemia, hypocalcemia, hyperkalemia.
Doctor, what is ARDS?
Acute respiratory distress syndrome,
Okay.
which is
What happens in this situation?
there will be increased pulmonary there will be two phases. Initial phase, there will be acute it will be there will be active pulmonary infiltrates by active inflammation by means of elevated increased effusion, and second stage there will be fibrosis stage of fibrosis, where there will be a progressive inflammation and progressive fibrosis.
And there'll be VQ mismatch. All right. Please tell me, how would you take care of the nutrition of the patient?
I would like to, if the patient can take oral diet, I would prefer the patient to be continued on nasal tube.
Total parenteral nutrition.
Total parenteral nutrition.
All right. Okay. How would you manage the pain in the patient?
I would prefer opioids, like parenteral opioids.
Please tell me, go through according to the WHO's pain ladder. Please tell me accordingly.
Okay. So for mild pain, I would give NSAIDs or paracetamol. For then moderate pain, I would start the patient on oral opioids with or without paracetamol. Then for severe pain, I would put the patient on IV parenteral opioids.
Okay, and at the end, patient control analgesia or epidural
analgesia.
Please tell me, would you or would you not consider giving antibiotics to the patient?
But unless documented infection is there, there is no need for antibiotic.
Yes, antibiotics are always according to the trust guidelines.
Yes. Okay.
Okay, this same patient comes to you after 6 months. Which one investigation would you ask for in order to confirm one of the complication of the acute pancreatitis?
Ultrasound? I'm not sure. Ultrasound?
No, serum amylase. You will
Amylase.
think of pseudocyst.
Oh,
Patient
okay.
is not getting well. So coming back after a while. All right, good. Thank you.